And I think there's three main ways you could use MRI. One is to improve the specificity of the PSA test. As we know, most men with an elevated PSA, with a moderately elevated PSA, do not have the sort of high-grade cancers we're interested in finding and we need to find. So in that particular view, what we would do is we would give a man a PSA test. If it was somewhere between 3 and 10 or 3 and 20, we'd then give him an MRI. If the MRI was positive, we'd go on to biopsy, and if it was negative, we'd just monitor that man. The second view is that, well, what we're really interested in is actually improving the sensitivity of biopsy. Because as we know with our standard trust biopsy, some people call it the random biopsy, a systematic biopsy, we actually miss some cancers. So we give a guy a biopsy, put all the needles in, maybe find a bit of Gleason 6, maybe find nothing, and then we repeat the biopsy 6 months later and we find some Gleason 7 or Gleason 8. And so should we use MRI, the fusion biopsy, to actually find those those missed clinically significant lesions? And then the third way we might use MRI is in the repeat biopsy setting. You've got a guy, you're pretty sure he's got cancer, and you don't find anything on the first biopsy, so maybe the MRI could help guide the repeat biopsy so we are not actually missing anything.